Hello everyone, and welcome to A Holistic Approach to Chronic Conditions. I'm Dr. Adam Seay. Many of you have stopped by our website and are watching this video and you have a chronic condition or you may be in chronic pain and are looking for a solution. Well, this video hopefully will shed some light on some things that I do in my office to help my patients overcome their chronic condition. The goal in my office for each patient is to have maximum positive impact on everyone that I see. I also want to remove any interference from your body that is preventing it from healing itself. The body's designed to heal itself, it just doesn't need any interference. And our goal, or my goal in my office, is to remove that interference. And I also want to reinvent your life. Not too many physicians say that, but it is truly something we want to do in our office, is change your outcome and give you the life that God has designed for you to have. Some of the conditions that we see in our office, this is just a handful of them, but there's so many different conditions that are out there, but it ranges from fibromyalgia to chronic fatigue syndrome. We see people with back and neck pain. We see autoimmune diseases. We see thyroid disorders, peripheral neuropathy, migraine headaches, or just regular headaches. We also see Lyme's disease, for example. If you get a chance to watch our video on Lyme's, we go over a lot of information there. We even see diabetes, type 1 and type 2, people that are not able to regulate their blood sugar either due to autoimmunity or due to lifestyle. And there are other conditions out there that we can help as well, like Parkinson's, Alzheimer's, other things where there's a big nutritional component and other aspects that we can help and improve the life and outcomes of these patients. So what makes me different from other doctors that you've been to? Because many of you have probably been on that roller coaster ride of going from doctor to doctor with little to no results. Well, my approach is a threefold approach. What we look at in the office is we use functional neurology, evaluating the nervous system to see where is there functionality problems with the ability of the nervous system to function. We also use some clinical kinesiology, where we muscle test you to find out what does your body need and where there's some nutritional deficiencies. And we look at other things that may be driving that, like infection going undetected. And we also use functional medicine, using lab tests to help us further identify problems that you're having that other doctors are not looking at. In order to allow maximum healing, you must be addressed neurologically and metabolically. It's the only way you're going to truly get to achieving maximum healing. Your brain must have two things to survive. It must have fuel and it must have activation. Fuel is going to come from oxygen and glucose. That's why it's so important to establish what you look like metabolically. And then the activation is going to come from the pathways firing correctly. So that's where our neurologic exam comes in so heavily in looking at how well are those pathways firing. We've got to make sure they're firing correctly. My neurologic approach includes a full functional neurologic exam. We test your reflexes, vibration, we check your digits to make sure you have sensation that's adequate through there. We do some functional testing on the cerebellum. We check a multitude of different pathways to see where exactly is dysfunction occurring in your nervous system. We also take your pulse ox to see what your oxygen saturation looks like. And we also look at your bilateral blood pressure. And that can give us some insight too as to which side of the brain may not be firing correctly. Some of the therapies that we use in our office are brain-based therapies. So we may do things with visual stimulation. We may do vibration. We may do spin therapy. There are so many different variations of brain-based therapies that can be done. We tailor that to each individual. Another big component that we use in our office is exercise with oxygen. Now, this is phenomenal in driving cerebellum and driving frontal lobe, and it helps tremendously with fatigue, insomnia, energy levels can improve with it. Just overall movement can improve when we drive cerebellum and we drive frontal lobe. And we also use eye lights. Eye lights are some glasses that we use to do light stimulation into the eye, sometimes the non-dominant eye, sometimes both eyes, depending on what we're trying to accomplish neurologically. And these do work very well to excite the nervous system and get the brain firing better. So your brain only knows how often something's firing to it. And unfortunately, it kind of works on that old adage, if you don't use it, you lose it. That's unfortunately how the brain works. If we're not rehabbing and actually stimulating the nervous system, we'll lose parts of it, and those things usually will come out in a neurologic evaluation. My metabolic approach, a little bit more detailed, but there's multiple things that we do look at, and this is a big one for a lot of people because so many people are mismanaged metabolically. we do a comprehensive blood chemistry. And I know what many of you are thinking, well, I've had blood work done, they've done that, they don't find anything. I'm not talking about just a comprehensive metabolic panel, a CBC, your TSH, and maybe vitamin D and your lipids. We're talking about going in grave detail, doing a comprehensive metabolic profile, but also looking at your uric acid levels, your magnesium, your phosphorus, your GGT, your LDH, looking at your vitamin D, and sometimes even the 125-OH vitamin D, which is the stored form of vitamin D, and also going into your lipids, cholesterol, HDLs, LDLs, and also looking at some inflammatory markers, things like C-reactive protein that's cardiovascular specific, looking at your homocysteine levels, also addressing your fibrinogen levels as well, and also going into components of iron, looking at your iron, your percent saturation, and also addressing your ferritin levels to see what your stored iron looks like. And we also go into a complete blood count with autodifferential and platelets, looking at your immune system to see if we find anything that's there. And we also go into the thyroid, not just running TSH or T4, but going into a detailed, comprehensive thyroid profile, looking at TSH, free T3, free T4, total T3, total T4, free thyroxine index, T3 uptake, reverse T3, and your thyroid antibodies, TPO and antithyroglobulin antibodies. Those are important to look at so we can screen someone to see if we're dealing with an autoimmune case, especially when dealing with the thyroid. And it also has a urinalysis in it. So again, we're talking about a detailed, comprehensive blood chemistry. Other thing that we find many times too, and this is the heart of a lot of chronic conditions, is infection, and usually viral infection. And some of you probably had this done before, but we run an Epstein-Barr virus, we look at cytomegalovirus, and then the herpes simplex viruses, herpes simplex virus 1, 2, and 6, and also parvovirus, B19. And the problem with this is some people think, well, I've had antibodies to this, but I had it at one point. These things never go away. They just deactivate, and they can reactivate as well, and they can cause a lot of chronic conditions. And most people get this stuff if you've ever been vaccinated. So this is something that most people have been vaccinated. We have these things in us. We got to identify, are these things activated, and how can we get the body supported to where these things are no longer activated. The other thing that we run a lot of times too, looking at the infection side, is a CD57 and complement C3A and C4A. This is kind of a nice screen for Lyme's disease. Usually Lyme's is the only thing that's going to drive down your CD57 and make your complements come up. And that typically is the scenario in which Lyme's does. And this is usually the only marker that will come or up in Lyme's disease. So it's a good one to kind of screen people for it, or at least we use that in the office to screen. You can also run a couple other things looking at some inflammatory cytokines, in particular tumor necrosis factor alpha, interleukin 1, and interleukin 6. These are great markers to see, is your immune system ramping up due to an infection. A lot of times Lyme's will drive this up, but it could be other infections as well. And we typically call this sickness syndrome. And this is just because the inflammatory markers are so high that you can't sleep, you're hurting, you feel bad all the time, and that's because of the inflammatory response from an infection. So we've got to identify what that infection is, and then get these inflammatory markers down. We also do a microbial stool analysis because, again, you could have things like intestinal parasites. You could also have yeast, fungus, or mold, or other pathogenic bacteria that's present in the intestines wreaking havoc on your body. So we need to identify what those things are and work on removing those from the body. Heavy metals are another big one, especially for those of you that are having chronic candida problems. Heavy metals are usually at the heart of this. You've got to get rid of the heavy metals so that you can then clear the candida out with any type of antimicrobial. So typically we want to identify what heavy metal it is and then ways to pull that out of the body. And we do also offer specialized testing depending on what you present with. So if we suspect someone may have exposure to mycoplasma, we may run some tests for mycoplasma. If we may suspect they may have food sensitivities or food allergies, we would then go to another lab that runs that. So this is just kind of a generalized viewpoint, but these are some of the big ones, especially in chronic conditions. And we also do clinical kinesiology. This is very important, because this will find things even sometimes subclinical that lab testing won't even show. And a lot of times we can get the body to improve and heal by addressing this. So clinical kinesiology is a great way of finding a fix for that particular problem. Other treatment options that we have in our office, we, as a chiropractor, we adjust people. So we do adjustments. We also work on rehabbing them as well, because that's important. We can adjust you all day long, but we have to retrain your body how to move correctly and how to hold that so that you don't go back to where you were before, so you have a long-lasting effect from the adjustment. We also utilize detoxification in our office. We do detoxification foot baths, and we do some nutritional cleanses as well to really help get in deep, help the liver, help the intestines, help the kidneys, to open those channels for detoxification, especially if you have infection. We've got to open those channels up so that you can clear the biotoxins from those. We offer natural, live source, pharmaceutical grade nutritional supplements, and these things make a huge difference when we give these to people and people take them. We do make some dietary changes as well, but this is where we're actually giving the body what it needs to heal, and this is a phenomenal thing that we use in our office. We also use cold laser. This one is a great one to help decrease pain. It also does some frequency modulation as well to target certain conditions or problems that the person has, even sometimes some organisms. This one works well on peripheral neuropathy, on pain syndromes, very, very well. Spinal decompression is another one that we offer, and we usually do a little bit differently than other offices do. We actually use oxygen with spinal decompression, and we have found using that we really run through that much faster than other places. We also offer active release technique, which is a myofascial release technique, great on pain, helping to reduce scar tissue and any other adhesions that form in the muscle. And we also do, again, exercise with oxygen, driving frontal lobe, driving cerebellum. We also use a device called Rebuilder, and this is a kind of like a electrical stimulation to help turn a certain pathway back onto the nervous system, helps with numbness, tingling, peripheral neuropathy, even pain syndromes. This works very well. And we use eye lights, again, doing light stimulation into the eyes to affect brain. If you're ready to end your chronic condition nightmare, please give me a call. Our number here is 919-662-0520. We can definitely help you with that. I'll be happy to sit down, go over your health history, go over any lab work that you've had done, and tell you whether we can help you or not. But I truly believe that we can help you overcome and get you back to living a life full of health and happiness. Thank you for watching.